The title of our next presentation is Splitting the Gender Difference in Favor of Reassignment Surgery for Intersex Patients. Please welcome Ferraz.
August 2012. New, hopeful parents, Eric and Stephanie Lohman, had just given birth to a beautiful baby girl, Rosie. After moments with tears of joy, the doctors came in with bad news. It's not that she wasn't intersex. It's that she wasn't a girl. Or was she? The Lohmans believed that the ultrasound gave them false information about the gender of their child. But after giving birth, the Lohmans realized that it was more than just a gender error. Rosie was intersex. She had an atypical reproductive system that contained both male and female elements. This young, loving couple had dreams and expectations for their new baby girl. You can only imagine the confusion her parents must have gone through. You can only imagine the questions that have rushed through her mind. How do we raise an intersex child? Does she remain intersex? Does she have sex assignment surgery? What do we do? To answer this question, we must understand all the possibilities of each outcome, but more importantly, what intersex really is. Intersex is part of a group of medical conditions called disorders of sexual development, or DSD. It is being born with having both a male and female reproductive system. In other words, hermaphrodite. This condition may seem rare, but it is a lot more common than people think. Dr. Candida Moss from the University of Birmingham states that about 1 in 2,000 people are born as intersex. And in that group, parents decide to assign a gender to their child and have them go under sex assignment surgery as an infant. Although having sex reassignment surgery is against God's natural creation, I believe that intersex patients who have been assigned a gender at birth should be allowed to have sex reassignment surgery. Patients who have been assigned a gender at birth by either their parental figure or their doctor have not been able to have a say in their gender or their medical solutions. Autonomy for these patients are taken away from them because the decision had to be chosen for them. But with that secret kept hidden from them about the nature of their sex, the relationship between the patient and whoever chose their gender will deteriorate. As Christian parents, they should help heal their child by allowing them to have sex reassignment surgery, but monitoring them so they can make a wise decision in their gender. Dr. Claudia Weissman from the University Medical Center Göttingen in Germany states that even at a young age, children are able to understand biological processes or to reflect on their identity, meaning that they know if there is something unfamiliar with their body. If the condition is affecting the child directly, then only the child will be able to understand that feeling, not the parent. In most cases, intersex children are able to take note of the eerie condition that has taken over them because they have contradicting reproductive glands. Parents are encouraged to give consent for a surgical procedure upon their child, allowing their child to make the decision for surgery. However, isn't it more correct for a parent to choose for their child, since an infant won't be able to decide a gender for themselves? If the parent chooses to assign a gender to their child, then there is a possibility that the whole family will soon have to deal with a disconnection in their relationship due to the ethical problem of how they have addressed the issue. Dr. Weissman states that a parent's role in DSD management is contested because the child's view is not always the same as the parent's preference. Parents need to foster the well-being of the child and the future adult in order to maintain a positive and loving familial relationship. This does not mean that a parent should have no say in their child's medical procedures. They should, but they must keep in mind all the difficulties that their child will go through in the future. Therefore, if a parent has assigned a gender to their child, then they should allow that child to go under sex reassignment surgery to avoid the distress in their relationship. The essence of it is that by having sex reassignment surgery in a conjoined decision, they will be adding to the loving and positive relationship in the family. In conclusion, all intersex patients should be allowed to have a say in their gender, but only when they are old and mature enough to make the decision in order to help their condition more and to avoid confusion in their bodies, their minds, their souls. They should discuss with their doctor and their parent about all the possibilities of each option leading to a different life path for an intersex child. Rosie Lohman is living her life, learning about her condition every day. Her parents chose not to perform sex assignment surgery on her, but rather keep her as intersex. Now, at 6 years old, Rosie is seen as an intersex activist, fighting for the new California bill, SB 201, which will ban cosmetic genital surgery on intersex patients until they are allowed to consent for it. As Christian parents, should help lead your child to a decision, not choose it for them. So, if your child is intersex, lead them to the right gender. Thank you.